Here at CPW Dentistry, we believe oral cancer screenings are an important part of your overall dental health. You should be receiving an oral cancer screening at least once a year as to catch any potential health risks early. At CPW, you will always receive an oral cancer screening through your hygiene visits or your comprehensive exams with your doctor. The oral hygiene screening consists of two parts. First, the doctor will evaluate the head, neck, and face areas for any abnormalities like swelling or bumps along the sides of your neck, as well as your thyroid. They will also evaluate the condition of your overall TMJ joint for any popping, clicking, soreness, or tenderness. So if you experience any of these symptoms, please let your provider know right away. The second part of the oral cancer exam is evaluating inside your mouth. The doctor will take a look inside your mouth and evaluate your cheeks, inside your lips, your palate, your tongue, as well as your throat for any abnormalities or areas that may be tender or sore. The highest risk areas for oral cancer to emerge are the floor of the mouth, the sides of the tongue, the undersides of the tongue, and the back of the throat. We really enjoy being your partners in keeping your mouth healthy, so if you have any questions at all, please ask your provider as we are here for you.